So in this section, what we're going to talk about is what should you do before you actually apply blood flow restriction. What are some of the things that we should put in place prior to launching a program like this? Risk assessments. We do what are some of the side effects? What should the intake forms look like? What should an implied consent actually consist of? So what are some of the contraindications to blood flow restriction? Let's take a look. Deep vein thrombosis. Obviously, we don't want to be restricting blood flow in those folks. Also, if they've got a pulmonary emboli or a history of that, hemorrhage or thrombotic stroke, clotting disorders, if they're on clotting medications, that can also increase bruising, untreated hypertension or hypotension, pregnancy, certain medications, and rhabdo. So all of these are part of our risk assessment that we need to make sure that we include in a part of our intake form or our medical history, making sure that we clarify this. And again, I provided you with a link down at the end of the page that has other safety concerns. This is not an all-inclusive list. It's just like anything with exercise. It is exercise. So if you've got cardiovascular disease, you need to be aware of that, and the patient needs to be aware of that, and there needs to be some kind of informed consent. So these are just some of the risk factors associated with blood flow restriction. So what are some of the side effects of blood flow restriction? Obviously, you're going to get some subcutaneous bruising. We are trying to restrict blood flow. There are different devices. Some of the devices are narrower than others. Some are going to cause a little bit more bruising than others. But we are putting a tourniquet type of device around the extremity, and we're doing exercise with that. So you may get some bruising with that. Numbness and tingling, that occurs in a low percentage, and quite honestly, you probably have that blood flow device on just a little too tight. Other things that you should expect is soreness. Delayed onset muscle soreness. It's a normal part of exercise. And yes, you are providing a new mode of exercise. People will respond to that. They may feel great when they get off the blood flow restriction, but the next day they may be a little bit sore. And that's okay. And we need to educate people about that. In my clinical practice, one of the things that I see that people complain about the most is a muscle soreness. If I don't tell them they're going to be sore, they'll come back and they'll let me know that they're sore. So we should educate people about that. The other thing that we need to do is educate them about the fact that there could be some bruising. Because sometimes people will associate that with, oh my gosh, what did you do wrong? Okay? We need to let them know, because we are doing blood flow restriction, that there is a chance that there may be some bruising. This is no different than cupping and some of the other techniques that we do. And we always educate the patient on the front end about what some of these side effects may be. So what should your intake form look like? It is imperative as a part of this program that you do an intake form, okay? It's not required, it's not FDA required or anything like that, but it is, and it should be the best practice. So we want to talk about best practice. So you should provide or develop some type of intake form. What you see here in this slide is this is one intake form that one practice has developed. You can take ideas from that, you can develop your own. But you need to consider issues from your state board. What are some of the restrictions by your practice act? What clinical issues do you want to make sure that you bring out? What are some personal limitations that that patient may have? And most importantly, what you need to do is keep up on the research. It's one of the things I think that as a profession we don't do enough of, and that is keeping up on the research. But if you're going to do blood flow restriction, you need to make sure that you keep up on the research. Although this started back, like we said earlier, this started back in the 60s, it is a new and emerging technique that is being deployed within healthcare. And as such, it is important for us to keep up on the research so that we keep all of our forms updated according to the most current evidence. So what should your informed consent look like? So obviously we've gotten what the patient's previous history is, we've gotten their history form, we've told them what the side effects are. So what should your informed consent look like? Number one, there needs to be some type of handout materials. Those handout materials should include the contraindications. We've talked about those. Should also list some of the side effects. Bruising, make sure you put that one on there. Commonly forgotten, but a lot of times when patients come back, it's one of the first things that they see. Warning signs. What are some warning signs? The tingling, the numbness. What are some of those things that they may experience if they're doing blood flow restriction? Equipment education. You need to educate them about the equipment. There should be some verbiage in there that describes what is blood flow restriction. People hear that term and it kind of may cause some people to be a little bit alarmed. You need to explain what is blood flow restriction. And then also the parameters by which you'll be deploying this technique with your patients. It's no different than when we do dry needling or we do cupping or anything like that. We always provide our patients with that informed consent. With blood flow restriction, we need to do that as well. So now we're going to talk a little bit about different types of blood flow restriction equipment. We're going to talk about some equipment options. We're going to talk about cuff location, where should you put the cuffs at, and then we're going to talk about width issues, which is kind of a big topic right now in blood flow restriction, and how do different cuffs, what are the difference in widths between those cuffs. And if you look at this doctoral thesis here, which again, we've provided you with a link, and I would encourage you to go ahead and pull this up. This particular doctoral student has done a ton of research in the area of blood flow restriction. And let's look at a statement that he had in this doctoral thesis. The actual device for restricting blood flow is likely of less importance for muscle adaptation than the actual degree of blood flow restriction and the exercise by which the blood flow restriction is combined. So that's a powerful statement. So it's not so much the device that you use as much as it is how much do you occlude and what exercise do you use. So those are two important things. So we're going to talk about that and we're going to give you some suggestions as we go through this. And most importantly, this is where your clinical judgment comes into play. Because as a clinician, I'm deciding how much I'm including that patient based on that patient's response. If I'm including them according to what the papers tell me I should be including them and they're having a negative response to that, I'm going to lighten it up. I'm going to choose the kind of exercises that I'm going to do with that patient depending on what I'm trying to achieve with them clinically. So what types of BFR equipment are there out there? Let's take a look at different, we're not going to talk about manufacturers, we're not going to talk about particular devices, we're going to talk about categories. You have your pneumatic electronic devices, and those are pretty expensive and they run anywhere from $2,000 up to $5,000. You have your pneumatic manual techniques or devices that are out there, and those can run anywhere from $600 to over $1,000. Then there's the non-pneumatic hybrid gel types of devices that are run around $300. And then there's, when I was younger and we were doing bodybuilding, we used to just take straps out of the gym, just rubber straps and strap them around your arms. So you can do those from $10 all the way up to $100. So there's a lot of different types of blood flow restriction equipment out there. Obviously, some are a little bit better than others. I wouldn't suggest wrapping straps around people's arms, but this gives you an idea of the scope or the spectrum of blood flow restriction equipment that is out there and how costly some of those can be. So why are we telling you all this? Because what happens? When we're treating patients, they go home and they use Dr. Google. And when they do Dr. Google and they look up some of these other devices, they may come across some of these more expensive devices, these FDA approved devices that say that if you use anything else, that you're putting the patient at risk. So we want you to be educated about all the different devices that are out there. What are some of the limitations of those devices? What are some of the side effects of some of those devices? But at the end of the day, educate yourself about all of the devices because you want to be prepared, because if they do go out and do that Dr. Google search and come back to you asking you why you did this or did that, you want to be well informed and give them an informed response. So one of the things that we need to talk about is cuff placement. This is really, really important. There are only 4 places where the research tells us that you should be applying a cuff. Number 1, up on the arm, as far up towards the axilla as you can possibly get. There are some devices that you'll see that have pictures where the blood flow restriction device is around the bicep. Do not do that. If you do that, you increase the chance for rhabdo. You increase the chance for bruising, you increase the chance for tingling and numbness and discomfort. The research is very clear that it's important that you only place the devices in the 4 spots designed. The second 2 are up in the on the thigh, as close to the growing area as you can get, providing that femoral compression. Again, we've seen people that try to put these devices below the knee. You don't want to do that. Those kinds of things you can actually do, and that will create an anterior compartment syndrome. So you want to avoid that. Cuff placement is absolutely critical. You need to make sure that you stick with where the cuffs are supposed to go and where they're designed to go. Anything outside of that, you're putting the patient at risk and you're putting yourself at risk. So one of the things that we need to know about blood flow restriction training is what should the cuff width be? And if you look at the literature, if you do an evaluation of all the literature that's out there, what the literature tells us is that you should not have anything narrower than 5 centimeters, which is 2 inches. And it shouldn't be any wider than 10 centimeters, which is 6 inches. So here I'm demonstrating a cuff that has a 2-inch wide area. The thing that we need to understand is, as clinicians, is that when you take this cuff and pump it up, your actual effective area is actually about right there. So this is not providing the occlusion, this is providing the occlusion. So what you've essentially done is taken this 2 inches and narrowed it down quite a bit. So as you're evaluating your cuffs and the kind of cuffs that you want to invest in, these are some of the things that we should be thinking about or considering when looking at blood flow restriction equipment. So this slide basically describes what I just said. And if you look at, for example, example A, what you see is a cuff that is 10 centimeters wide. When that cuff is blown up, what you see is that max pressure is at 250 over a very small area. As you go down that gradient or go down that bell curve there, what you see is that that pressure drops off immediately down to 50 millimeters of mercury. So even though you may be thinking you may be occluding across that full 10 centimeters, in actuality, you're only occluding off a very smaller area. And what does the literature tell us? It should not be smaller than 2 inches. So again, what you want to make sure that you do is don't look at the width of the cuff. You actually look at the actual area that is actually impacting. And the reason that you're doing that is because this is the area that's going to impact. So if I'm pumping this up on an athlete, what I'm doing is basically restricting their motion over this width of the cuff and only occluding on this part, which ends up adding to a lot of bruising that an athlete may see. For example, if I'm using this with bicep curls, I place this up on their bicep, I've got a nice wide cuff, I'm restricting their bicep motion, but I'm only occluding a small area. And that may add to some increase in bruising. So when you're evaluating your cuffs, not saying that particular type of device that you should use or anything like that, but be critical when you look at these things. It's not the width of the cuff. Pump it up and see what is the occlusion area. And remember that slide where that slope and how much that pressure drops off pretty quickly just outside of that peak area. This is a really critical point. And the reason that I'm spending more time on this is because this is not anything that anybody's talking about. Manufacturers are not going to highlight their weaknesses. But we as clinicians and we as practitioners have to critically evaluate this stuff. And what we know from the literature, from this slide here that I've presented to you, is that that occlusion area is very important. And when you pump those things up, what you need to do is actually pump it up and critically evaluate that. And look how big that slope is. It's something that we can all see. But again, it's something that is very critical and a key point that you need to evaluate when you're looking at what type of blood flow restriction device are you going to use. So the same thing can be said about straps. Some of the unsupported straps. So if I've got a strap around my bicep, for example, and I've got a plastic clip right here, that band is going to remain that distance. But the band over here, as I'm curling my arm, what's going to happen is it's going to bind up. So that area of pressure is going to become much, much smaller. So again, these are some of the things that we need to think about when we're looking at blood flow restriction devices. So obviously this cuff being too narrow, too wide is obviously a very important thing. I want to highlight something on this particular side. The clip that I was talking about, the strap, the unsupported strap that I was describing, is actually pictured here. And what you see in this particular picture is that where that plastic clip is at will remain that 2 inches. But up towards, more towards his bicep, where he's actually curling, what's going to happen is that belt's going to curl over. And that's going to create a higher level of pressure and discomfort. Now, with narrower straps, one of the things that we need to know is that when you use a narrower strap, you have to use more pressure to occlude. And oftentimes that will lead to pain, discomfort. It'll often also lead to bruising. It could potentially lead to some nerve damage, because if you have to use too much pressure, then you're going to occlude the circulation for the nerves, and that could lead to some nerve damage. All of that said, the patient's going to feel more uncomfortable. They're going to have more bruising. So the next time when they come in to see you and they've got these big bruises on their biceps and reported a lot of pain that they had during the performance of the exercise, the less likely they are to want to use it. And at the end of the day, we want to use blood flow restriction because it's going to help us achieve a faster outcome with our patients. And if the patient doesn't like it and they're having more pain with it, they're not going to do it. This particular slide, we're going to talk about why a cuff's too wide and what that can do. First thing we want to notice is we already talked about where the cuffs should be placed. And what you see in this particular picture, number one, is too wide of a cuff placed on the bicep and placed on the bicep and not up towards the axilla. So you can only imagine that if I pump that cuff up, I gave you a 15 or a 20 or a 30-pound dumbbell and had you do some bicep curls, that's going to cause you a lot of discomfort because you've basically constricted your bicep against a contraction. You've pumped up against resistance, and now you're asking it to contract fully. That's not blood flow restriction. That is restricting range of motion, and that can cause pain. That will also cause an increased potential for bruising. The other thing that wider cuffs will lend to is reduction in nerve conduction velocity. Now, as an ACL guy and movement guy, we don't want that. We want nerve conduction velocity because that is very important for the feedback mechanisms to the brain. It's very important for retraining of movement. So the last thing I want to do with my blood flow restriction is add something that's going to inhibit that system that I'm already trying to train. And then finally, with the wider the cuff you go, the more likely you increase the risk for rhabdo. And that is definitely not something that we want to get into. So you may be hearing all this and you'll be like, whoa, I'm not doing blood flow restriction. Too narrow, too wide. No, that's not it at all. What we want to do is we want to provide you with information. We want to provide you with information that if you do get a cuff that is too narrow, what kind of things should you be looking for? If you do get a cuff that is too wide, what kind of things should you be looking for? And then most importantly is how do you make an informed decision as a clinician? Because at the end of the day, what is our goal? Our goal is to improve our outcome with our patient in less visits. Our goal is to improve our outcome with our patient and provide them with a better outcome at the conclusion of our rehab or whatever it is that we're doing from a training perspective. So by having a more informed decision about cuff width, for example, then we provide our patient with a better medium for proper training. And we can more critically evaluate what we should be applying.